and thank you for tuning in to this episode of the Parent and Caregiver Voices Project. In this episode, we'll hear from Yustine, whose son has eosinophilic esophagitis, or EOE, an immune condition that affects the esophagus and is chronic. Dr. Nicole Dempster, a pediatric psychologist at Nationwide Children's Hospital and the co-chair of the Clinical Practice Subcommittee of the Caregiver Wellbeing Special Interest Group of the Society of Pediatric Psychology, will be interviewing Yustine about taking care of herself as a caregiver of a child with a chronic medical condition. Their conversation goes beyond what we typically think about as self-care and includes strategies for individuals to find out what works for them. We hope you enjoy.
Well, thank you so much for joining us today. We are so appreciative of everyone's time. We're here today to talk about navigating self-care when having a child who has a chronic health condition. To first introduce myself, I am Dr. Nicole Dempster. I'm a pediatric psychologist at Nationwide Children's Hospital. I spend most of my time with people who have cardiology conditions such as congenital heart disease. The thing about congenital heart disease is a lot of the intervention happens when children are babies, so they're in the hospital during their first few years of life. So I spend a lot of time with caregivers trying to navigate the stress and how to promote their best well-being in order to help their children. I'm really excited about this interview today, and I'm going to let Yustine introduce herself.
All right. Thank you very much, Dr. Dempster, for having me here today to share my experiences. And my name is Yustine. I am a psychology student, and I have a 7-year-old son who is diagnosed with eosinophilic esophagitis, which is commonly referred as EOE. And I also have a 5-year-old girl.
Well, first of all, just being a student and raising 2 children, life must be busy.
It is very busy, extremely, extremely busy.
Maybe you could start for some of our viewers to just explain what EOE is.
So EOE is an inflammation in the esophagus. It's sort of like an allergic reaction. And so what happens is that if somebody with EOE, if they are exposed to their allergens or triggers, it will cause inflammation in their esophagus. And so if they're exposed to these triggers constantly, they will have their esophagus will become narrower, smaller. And what will often happen is that they will choke on food. And this requires a visit to the emergency room. Other children also experience vomiting, nausea, a lot of pain in their chest, pain in their stomach. And so it really depends. Not everybody develops the same symptoms with EOE, but overall, they definitely all have inflammation in their esophagus. And yeah, that's pretty much the overview of it.
Sure, and I'm just kind of thinking about the world, and that means the world is probably full of triggers that you spend the day kind of looking to navigate and making sure you avoid for your child for lots of reasons. One, to avoid the health scare and just the discomfort and the things that they would feel that would also ruin their days. Other things for management, like going to doctor's appointments or having medical tests?
So for management, I would say at the beginning of the diagnosis, that's when it's very intense because there will be a lot of scopes that need to be done. So endoscopies where there's a small tube that they put down into their esophagus just to see how it's doing and to take biopsies. And depending on the type of treatment that the gastroenterologist or the parents decide, the first year can look very different for us, for our family. We opted not to treat with medications. And so what we decided to do was to do an elimination diet. that required a lot of scopes and a huge change to our diet all of a sudden. I mean, coming out of that appointment, my son could no longer have wheat, dairy, eggs, soy. Um, I think we also, no, we started with those four. And so explaining that to him
Mhm.
is really difficult. At the time he was 4 years old. So how do you explain to a 4 year old that you can't have your favorite snack and you can't have eggs, which he used to love to eat? And then what happens through the elimination diet is once you've gone 3 months with your child not eating these triggers, you go back, you do a scope. Did it help the esophagus? Did it not help? And so it's a lot of back and forth between medical appointments, scopes, and also the dynamics in the family that have changed.
Wow. That, that is a lot. I can only begin to imagine what that experience was like. As pediatric psychologists, we spend a lot of time developing materials for kids. How do you explain this to kids? How do you help them navigate, self-advocate? But there's just starting to be attention on like what this is like for the parent to go through. Both you have to think about so much and your emotional experience of wanting the most for your child and having to do all of this. This is a really broad question, but could you just start with like what was that journey like for you?
Um, that journey was a very difficult journey. Um, so I suffer from a lot of anxiety, and the trigger for my anxiety is when my children would be sick. So this just set off like a really, really big, difficult experience in my life. It's something that I will definitely remember. Um, but I think what was really good about it is that it forced me to work on myself. It forced me to recognize um, the different things that I had to do to bring that anxiety down so that I could be there for my son. Because if I'm not well myself, I can't give him what he needs, which is being there for him, being present, staying calm throughout the appointments is extremely difficult. I mean, when there's sedation going on and there's like blood samples and needles and so I needed to learn to take care of myself in that sense so that then I could take care of my son and help him with his anxiety for the procedures that he had to go through.
Yeah, what a mountain. I think there's a little bit of sometimes pressure as parents to be strong, get it together, be strong. But we don't always talk about like what are the strategies to help you be strong? What are the specific things that you have done for yourself over these past few years to help you manage that?
Um, so the strategies, I would say that it took still to this day, 2.5 years after his diagnosis, I am still like trial and error. And when I speak with my friends or when I read things online about what has helped others, I'll implement it myself and see does this work for me.
Mhm.
Um, and I think the biggest one that has made the most difference was changing the little voice in my head because I was very hard on myself. Um, and so I would I would be like, um, that little voice was not very kind. I would put a lot of pressure on myself to, for example, oh, I have to have homemade baked muffins for my child, and I have to make sure that he has the best diet. And so, in the moments where life would get very busy, and I would make him craft dinner, not the one that we all know because he can't have that one, but a modified version of it, then I would beat myself internally like, oh, he has this condition and you're not giving him like this very healthy, super like vegetable ridden meal. And with time I learned that it's okay. He's happy. And this modified craft dinner is actually not that bad either, and it has what he needs. And so doing that, really working and recognizing when I was being so difficult on myself has been one of the things that has helped me the most, and being flexible as to it has been a big week. I haven't had time to maybe do the things that I would want to do for my son, but he's happy. He has other meals, other things that he doesn't mind at all having.
Yeah, that must have taken a lot of practice.
It still does to this day. I mean, there are days where I have a bad day. Like yesterday was one of those days where I was just like, I didn't get done what I wanted to get done and I wasn't as productive. But I think accepting and acknowledging that having a having a child with a chronic illness is difficult, and accepting that there will be days where I won't be as productive really helps.
Mhm. I'm so appreciative you actually said that, because in a lot of conversations we sometimes talk about, well, I changed the voice and then it looks like it's all better, but it's probably something that we're always recultivating with ourselves and catching those times where we're being a little bit hard. And I really appreciate you saying that. What are other things that you have maybe done in terms of finding activities for yourself or relaxation? What have you found feels the most grounding for you?
Um, so for myself, I did try to do scheduled activities. And so um, I would take a day where during the winter I really enjoy skiing. And I said to myself, okay, on Wednesday evenings, once the kids are in bed, I'm going to go skiing. But I actually found that different types of scheduled activities would actually add to my stress and add to this already busy life and busy schedule. And so I moved away from scheduled activities, and I started reflecting upon what do I enjoy that I usually don't take the time for, that won't require me to schedule something. And so I really enjoy reading. Um, and what I started doing, which I get very mixed reactions about this, but I actually set my alarm and I wake up an hour before the kids. So this would mean that I'm usually up around 5 in the morning, and I love drinking coffee. Like I very much enjoy having a cup of coffee in the morning. And so I took my coffee machine and I put it in my night table. So I wake up at 5 in the morning, I make my coffee, I read, I do a Wordle, and I have found that it doesn't happen every day. There are some days where I just don't wake up, I don't have coffee because I'm tired, and I allow myself to, okay, well, today I just don't feel like waking up so early. But most of the days when I manage to do this, it makes such a big difference in my day, because I have been able to take this time for myself to plan my day and reflect upon it. And it just cascades as well, for the children. When they wake up, they see that I'm awake, I'm calm, I'm there for them. And it has been really great having the opportunity to figure out that this is something that works for me. I also tried doing it during the evenings, but it's not the same. I'm exhausted from my day and I just feel like I don't enjoy it as much. And so I think for the caregivers listening to this, I think what's important is just trying and listening to yourself, and figuring out what works for you, what works in terms of what makes you feel happy, and what makes you feel better at the end of the day. And that can look differently for different people.
Yeah, I think you really model trial and error, right? We tried one thing, that didn't work, tried another, and everyone does find their different grounding in different ways. But I feel like a quiet house and a cup of coffee is a moment maybe everybody can bond with there.
Absolutely. Absolutely. I would definitely give it a try.
Yeah, I felt more zen just hearing you. Like, oh, that does sound calm. Excuse my light here. Um, when do you feel like life maybe gets in the way of your own self care? Are there certain times of years or things that are happening where you recognize that maybe it gets a little bit more challenging?
Absolutely. So as a student, I would say definitely midterm and final exam period.
Mm.
And as a mom, birthdays, holidays, and having a child with EOE, there's an added layer because if somebody else is hosting Christmas dinner, I have to make sure that my child can eat what they're serving. And so I will often communicate with the person and ask them like, can you use this vegan butter instead of the butter that you're using? And if I feel like it's too much for them, then I will offer and I will say, well, I will bring Thanksgiving is coming up here in Canada. And so I will say, well, I will bring his potatoes and I will bring um, his green beans with his butter. And so during these times, I would definitely say it becomes increasingly difficult to take care of myself. What I found has helped is specifically for school, I make meals in advance and freeze them. So like spaghetti sauce or shepherd's pie, which is something that's very common here in Quebec, and my son loves. And so by learning and recognizing that these difficult times are coming up, I can prepare in advance, and that really makes a difference in terms of, well, if I don't have to cook dinner, well, maybe I can take 30 minutes and just sit down, go outside, take a breath during these difficult moments.
Yeah, that really weighs on, I think, yeah, the amount of holiday stress that all parents feel like, and the list that you keep in your head all the time. And you have a layer wrapped around all of yours of having to advocate, communicate, and plan even more.
Absolutely. And it's the same with school activities. So my son's school activities, if they're doing something that revolves food or snacks, I have to coordinate that as well um, and make sure that he's included because I think it's not only about making sure that he's safe and that we don't cause any inflammation in his esophagus, but it can also feel very isolating for him if the school has a pizza day and he comes in and he doesn't have a pizza. um, and so as a mom, I'm like, okay, it's pizza day, so I'm going to make sure that he has a pizza that he can eat in his lunch, and it definitely takes a lot of organization and management.
Yeah, and right now you're just so wonderful and thoughtful and kind. It almost looks easy. I imagine it is very much not. Do you allow yourself the hard moments, and how do those look?
Um, there's a lot of hard moments. It is not easy. But with time, we definitely uh, learn to adapt and we learn to figure out what works for us. During the difficult times, what that looks like is um I will I will often cry. I will feel overwhelmed. Um, and I'm very thankful that my husband and that I have my husband
Mhm.
and that a very we have a really good communication. And so having him there and being able to tell him like I am having a really difficult time. I am feeling overwhelmed and what we will usually do as a couple is he will say, okay, take the evening off and I will take care of the kids, and vice versa. he also has very difficult times. So he has EOE. And so sometimes he does have food that gets stuck. And all of a sudden, I'm all alone with the kids. And that can be really overwhelming too. I think just allowing myself to live those emotions and to be open about it, especially in front of the children. Before all of this, I would not be comfortable crying in front of my children. I'm still not 100% comfortable, but I realize that it's an important lesson for them to see that, well, we're not always happy and life doesn't always go according to plan. And it's okay to live out those emotions and to sort of have those conversations with them has been really great in terms of bonding, but also starting to teach them about emotional management and how to manage these big emotions that we all feel, not just adults but children too.
Yeah. Thank you for being so vulnerable and open. I think self care is so important, but it actually includes having real feelings at the same time, and skipping over that probably makes the strategies not work as well. So, thank you for sharing that.
Yes. I will admit though that sometimes I I do have to I skip them. It's not all the time, but I do make sure that I set a time afterwards to sort of go back to those emotions. Um, so I do part of my research at a hospital, and sometimes I see children that are sick, and that will be a reminder for me of my own experiences. And during that time, I mean I'm at work, and so I can't really just, I mean, I guess I could, but I don't feel comfortable breaking that down in that setting and crying and having to open up to my coworkers. And so during that time, I sort of like just put it to the side. But then later on, when I'm driving back home, then I will go back and revisit that because at the beginning of this whole experience, I would just bottle up everything and you have to be strong and it could be worse. And that's sort of the self-talk that I had, but that would lead to a lot of exhaustion, irritation, um bursts where I would just be like very upset um for these tiny little things. And I realized that by starting to be more open and to take the time to work on those emotions, that it certainly helps.
Yeah. It sounds like those are your warning signs, like, oh, maybe I haven't really spent some time and some space for me when I start to hit those levels.
Absolutely, absolutely. There for me, there are other warnings, warning signs. Like my muscles will be very tense throughout the day. Like I'll notice that, oh, like my knees hurt and my arms hurt because I tense up when I'm very anxious. And so when I start realizing, like I've had to pay attention to these warning signs, and when I start seeing that coming, then I will try to tell my husband, I need an hour or two to myself this evening, or can you put the kids to bed so I can have an extra time to myself? And it does help. It definitely helps to know what it is that when you see it coming, when you see that you're getting to that point of, I need this time.
It goes back to what you said earlier about trial and error too, right? Like you have to hit some of those moments where you do have some harder moments to recognize, okay, new trial.
Absolutely, absolutely. And I'm curious to know, on from your side of things,
Hmm.
what have the parents that you've worked with, how have they handled um, this part of their journey?
Yeah, I mean, that's a great question. It's the most humbling job I've ever had, to walk into a family's room when they're in their hardest moments and to see how open they can be to really talking about these things. And it can sound too simplistic, but sometimes just being heard. Because as a caregiver, you're nonstop go. What do I need to pack next? What do I need to think ahead next? What are we going to need to do today, tomorrow, and 3 weeks from now? And you just keep going in your head, and sometimes just laying all that out there of like what I am feeling, what is going on day to day, sometimes can be just half the battle of just allowing yourself to process it out loud, but also to feel validated and heard. And that can quiet that voice in your head you talked about earlier that might be judging yourself. So it's just been one of probably the most wonderful experiences of my life.
Thank
Um,
you. Thank you for sharing that. And I think you bring up a really good point. That was one of the ones that I also struggled with, was feeling like I didn't have a support group. Um, Other moms or other caregivers that were going through the same experience that I was going through. And I'm really I'm really lucky that my husband has lived through this and he has been able to help our son very much throughout the process. But sometimes um, he's a lot more calm than I am. And so he doesn't see things the same way that I see them. And so connecting with other caregivers that are sort of at that level, that become very anxious, and just sort of having somebody else validate what I'm going through um, has been really, really important. And I had to go find this group on my own. I did ask my son's gastroenterologist, I said, is there any support group? Like, is there any program set up in the hospital? And unfortunately, where we are, that is not the case. So I had to resort to social media,
mhm.
and and I mean, I'm really thankful that I was able to find this community of EOE caregivers. But it can also be, it's a double-edged sword, because when I'm feeling really overwhelmed, and I go to this group, it can actually overwhelm me even more, because there are other parents living a lot more extreme circumstances, and then I think to myself, oh my goodness, is this going to happen to my son? Am I going to be living through this? And so what I do is, when I go into these groups, I make sure that I'm not as vulnerable, that I'm in a really good place mentally and physically. And it's been really great because I have been able to help other caregivers in sharing my journey and sharing my experiences. But I am very careful as to um, when I go there.
I think that's a really great point. Something we've talked to the parents about too is when you follow all these groups, you find this overwhelming sense of support. And sometimes maybe you want to bum out on social media and weren't looking for these things to just pop up on your feed and remind you of all the things that you have to do, maybe.
Exactly. I'm really glad that you brought that up, because I actually made a change in my Facebook page so that I wouldn't see the posts from the group, because I realized that it would be a trigger when I was just like, oh, during my time off, and I'm just like scrolling. I want to see what other people are up to. And then I see a post of another caregiver that is very overwhelmed. And so it doesn't allow me to enjoy the time to myself that I have, which is not a lot and it's not often, but I try to make sure that whenever I am in that moment, that I'm really taking that time to myself as much as I can.
Yeah, good for you for being so proactive too. Socially, so you probably have like people who know what EOE is. What about your typical social support group, your extended family and your friends, and explaining this to them? I find people sometimes really quickly want people to be all better. and say like, well, just do one yoga and then you'll be calm? Have you had to sort of advocate to them on like what self-care looks like as a journey for you?
Exactly, exactly. I have been really lucky. Um, my mother and well, my parents-in-law, they understand. I mean, they're not retired, so they don't have all the availability in the world. But whenever they can, they will reach out to us and say, "Oh, would you like for us to take the kids this day?" And it just makes a big difference because it makes us feel like they understand the difficulties that we're going through. Just gonna take a sip of water while you and so it makes us feel understood, but that wasn't always the case. And it definitely has taken a lot of like honest talk with our friends and in saying we're sorry we can't make it to all the events that are planned and we would love to be there, but we have to take care of our children. And at the beginning it was difficult because they definitely did not understand what we were going through, and already being a parent is a lot. But then when you're a parent that that when you're a parent to a child that has a chronic illness, it just adds this whole other layer. And so um, I think being honest with our friends and being honest with ourselves, like we can't be there all the time. um, it's the way it is.
Yeah. And you're parenting to introduces all those challenges. And then when you have a child who has a chronic health condition, it takes it even to another level. You mentioned something of being honest with yourself. And sometimes when I think about self care and that tiny little voice in our head that can be a little unkind, what are you the most proud of that you have done over the past 2.5 years in navigating this journey?
um I would say that my personal growth, um this journey has taught me a lot about myself. um and I don't know if I would have been able to learn all these lessons without it. And so I think I'm just so proud for not giving up on myself, on my family, um, and to just try and learn. Um, there were times where people were like, "Well, if this is so difficult, why are you still going to school?" And to me, it's I love studying what I'm studying. And in the future, I want to be able to help other families that have gone through what we have been through. And so I think just sticking through it all and learning from it has been is one of the things that I'm really, really proud of.
Well, from an outsider perspective, I would totally agree. And I think while it doesn't always feel like maybe you're directly, we do everything for our children, but this doing something for yourself is probably what's growing your children so much. And I think that's really impressive.
Thank you.
Thinking about wrapping up, if you had to give 2 pointers to a parent who is just starting this journey of sort of addressing their own self care as they go forward, what would that be?
So I would say that guilt is normal. As parents taking that time off, we feel like, oh, I could be doing this, I should be doing that. And so I think I always think of the example on a plane where you have to put on the oxygen mask yourself to then be able to help others. And so if you take the time to take care of yourself, um, it will help you be there for your partner, for your children. Um, and so I would say that that is one of the biggest things. And also that this is a very difficult journey. And to know that you're not alone, that there are other caregivers going through it, and if you can reach out to others, that'll be very helpful as well.
I think you hit it on the head. Fantastic. I always say, like, there will always be laundry, right? Like, you can do all the laundry in your house, but eventually you're going to take off these clothes and then there's more laundry again, but there won't always be 10 minutes to read a book. And so you should take it when you have it. And I think you've really worked your way through that and found it.
Yes.
Thanks so much for sharing your story and yourself and your time. I think this will be really helpful for others to hear.
Thank you. Thank you for having me. And I really hope that it will help in any way. And just thank you very much. Thanks so much for tuning in to this episode of the Parent and Caregiver Voices Project. You can find more information about the Caregiver Wellbeing Special Interest Group and the Center for Pediatric Psychology at the links in the show notes. You can also follow the Caregiver Wellbeing account on Instagram to get more information about caregiver wellbeing and to stay connected. You can find us by searching Instagram for Caregiver Wellbeing SPP. Is there a topic that you'd like to hear a caregiver talk about? Let us know by leaving a comment or sending a message to our Instagram account. Thanks so much for listening today, and a special thanks to Yustine and Nicole.